guys. Welcome, welcome. I'm so excited to share with you some Lyme information. It's question and answer period. It's what I want people to know as a Lyme doctor and how I got into this space. And of course, the majority of the time is going to be about question and answers. And so this is going to be really fun. This is a really cool opportunity for me literally to share with people. These are the most important things to know about Lyme disease. It's so lonely to have chronic Lyme disease. I always feel like people are right here in the middle, and you have, your partner or your spouse, your husband, your wife, your neighbors, your friends, the health food store, a natural medicine doctor, a traditional doctor, a Lyme literate medical doctor, and then what they're doing is they're all telling you to different things. And so it's super, super lonely to see that. So one of the things that I wanted to share with people is the opportunity to just ask questions. And so you'll see it over here in the chat. And I have people over there already. Macy's going to help me answer questions. Jose's going to help me answer questions over here. And so, Mike, I see you. I see Cora. I see Linda, all the way from Montana. Hi, Linda. I see Sam, another Linda, Carrie, Mamie, sorry. Just tons. We've got people I see over here from Rhode Island. I see Texas. I see Idaho, Montana. I see California. I see Missouri. And this is what's fascinating about the Lyme world is there's no boundaries. Like, this is one of the myths that I'd really like to dispel and tell people, look, just because you don't live in a Lyme area, it doesn't mean that you can't have Lyme conditions, because guess what? We're traveling. And anyway, we want to go over a couple different high-level points. And then I can see everybody over here in the chat. We really want to focus on questions. And by the way, you guys, sometimes people are like, hey, I just want to jump right to the front of the line. I want to help right away. Look, you can do that right away by going to lymefighter.com. And we have a really neat system over there. There's some resources that you can do. And in the resources, like, look, you get the guide. You don't have to fight this on your own. And if you want to literally just go there, fill out the information. There's no cost or obligation. And then here's what happens out of that is we just get to start working with you and help, whether you're across the street or across the country. A bigger picture is I'm commitment to literally help as many people as possible to beat their disease. Like, I believe so strongly that you're not your diagnosis. And one of the frustrations that I see in Lyme disease is people think, look, we'll just give you 2 weeks or 3 weeks or some maybe long-term antibiotics and it fixes everybody. And that's not the problem. The problem is what happened to the body breakdown so that the infection can take off. It's kind of like the herpes simplex one. This is the cold sore, canker sore virus. Literally 100% of people have been exposed to this. And there's so many people that don't get cold sores. And then there's a smaller percentage that get them sometime. And then there's an even smaller percentage that get them all the time. But here's what's beautiful about that is when we put the body back in balance, I believe people that can be normal. And I also believe that with Lyme disease, there's things that people need to know to absolutely live a better life. And so that's why at the conclusion of May, May is Lyme Disease Awareness Month. And I just wanted people to be aware of so many breakthroughs. And so we're just going to start covering these different points. And then look, if you have a question, please hit us up in the chat. I'm already starting to see some questions over there. Let me look at this. Like, I see, why do Lyme symptoms come and go? Some days I feel normal. Some days I crash. Why aren't antibiotics working? I've heard about some treatments that you're offered. Tell me more about those. Like, we're going to hit up those in the comment section. I would love to know where people are. And like Michael over here saying, I'm watching from Penn State. Shelly says, hey, I'm from Michigan. Hey, Michigan represent. Tara saying, I'm from Eastern Kentucky. Katie, one of my peeps, Inner Circle. Hi, Katie. She comes from the normal side of Boise, of Idaho, which they say is Boise. Now, I'm on the other side of Boise, the kind of the forgotten side. Sandy says, watching from New York. I'd love to know where you're at. Drop in a comment here. And of course, I want to really create a value. I want to make it absolutely worth your while to go over. And here's the things that I wish people understood about Lyme disease. And so thank you for participating. Let's jump right into it. So let's just go over a couple of things about Lyme disease and what you're experiencing. So if you're watching this, most likely you're fighting some type of acute or chronic Lyme. It's really lonely, just like I said, where you have all these people giving you ideas and then you kind of get dismissed or poo-pooed by the CDC or traditional medicine, or your doctor sometimes will tell you, I don't believe in this. It's like a religion or something. And it's not a religion, like it's just facts. And a lot of times I feel when doctors say, Lyme is all in your head or it's a made up disease, what they're saying is, I don't know what to do, or I haven't been educated or exposed to this thought process. And that makes me really sad for patients. So if you're one of those patients that have been dismissed by traditional medicine, or you're kind of a round peg that doesn't fit into a square hole, one of the things that I would say is, like, keep going. I believe that there's so many things that can help people. And no, I don't have the corner on every single Lyme disease case. Like, I've helped a lot of people. It's not just me saying it. Like, you can see hundreds of success stories on our YouTube channel and in our blog and our Facebook channel. But there's also people that I haven't been able to help. And even though it's a small percentage, why I say that is because you, as a Lyme disease sufferer, or if you're watching this on behalf of someone else, your spouse or your kid or your cousin or your best friend, like, you're not alone, and you gotta be that warrior that just doesn't give up, because there's things out there that I see people get breakthroughs, and it's just so important to keep going. And I'm going to share with you some really neat success stories on this. So please mention where you're from. Let's see, we've got, Eva's saying how many co-infections, so we're going to hit that. Carrie says Wisconsin in the house. Dee says, hey, I'm in central Pennsylvania. Lee says we're in Pennsylvania. Don saying, hey, it's Arizona. Hi, Don. Holly Hendricks, Holly right here. It's so nice to see you. And then Montana's in the house. So you guys, let's start going through a couple things about this. So let me just give you a nugget to start with. So here's what I think so much of traditional medicine and a lot of Lyme litter doctors are not aware of. I feel that one of the biggest things for Lyme disease is you've got to help the jails of your body, or your infectious processing centers. And so those are the lymph nodes. And so if you get nothing away from this, let me just help you here. So I feel lymph nodes are the jails of the body. And what happens is when we have an infection, and Lyme disease is an infection because there's a breakdown in the body. But here's what happens is these white blood cell warriors get around, and like, if this is the bacteria, like, it totally goes around it just like this, and it engulfs it. And then literally I feel it takes it over to the lymph nodes. That's the infection processing centers. And what happens is sometimes the jails can get full. And there's a whole thing about the retained antigen theory and immunology and some other things, but we've got to help the lymph nodes to be clean. And so one of the ways that we can do that is we can take a mineral, we can take potassium, and we can take a digestive enzyme, some hydrochloric acid. And what happens is that changes the hydrogen ion content structure in the lymph, and it helps to get it to drain. So this is how we can drain the lymph nodes. So you got to work on your drainage pathways. So that's number one. And then, like, the most neglected glands in the body, the most in medicine, like, they don't even pay attention to this. It's the thymus, the spleen, and the lymph nodes. So what I'd like to share with you on this is the thymus gland is right here, and it tells the white blood cells, like, it educates them. It's like a boot camp, and it tells the natural killer cells and all these things, like, okay, if you see that guy out in public, like, you got to kill him, that being the bacteria. And so there's a there's a really neat way to stimulate and help to treat the thymus gland and also the blood reservoir, which is the spleen. So if we work on the drainage pathways, we help the thymus, we help the spleen. Like that's just such a nice way to help people to move forward and to improve and get their drainage pathways going. Now, that goes without saying that we want to work the phase 1, phase 2 detox pathways, which is the liver and the kidneys, to like we got to drain the toilet. So I tell this to people all the time, and not in a bad way, but so many people agree with this. And that's this. Your body, when you have chronic infection, the body is literally like a clogged toilet. We have all of these things inside the body, and there's no drainage way to get out of these. And so how do you fix a clogged toilet? Well, you gotta fix the drainage pathway. So sometimes you have to stir things up to get it to drain, and then we can really go to work. So one of the most important things, really work on the drainage pathways. So there was a nugget that we do, like number 1, change the hydronic content structure in the lymph nodes, work on, of course, the liver, the kidneys, the spleen, and the thymus. Now, if you're coming on during this live process, so I've created a way to help people called lymefighter.com, and literally here's what it is. And if you want to know more, if we want to get information, we have a wonderful guide over there at lymefighter.com. It's free. And the purpose why I put that book together is because I'm on a mission to help as many people as be possible to beat their disease. Now, Lyme is something that has showed up for me in a big way. I didn't choose to be a Lyme doctor. Matter of fact, you guys, this is what I learned about Lyme disease in 8 years of school. 4 years of graduate school, 4 years of undergrad in sciences. And then I got into practice, and my dad got really, really sick from a heavy metal poisoning. So he broke the crown. He had a mercury post, was in high school. This was when my dad is in his 60s, and he bit down on a walnut and the crown cracked. And what happened is he got heavy metal into his system. Now, we didn't know this at the time. Now, my dad didn't have Lyme disease, but the story is really important. This is how the universe chose me as a Lyme doctor. And so here's what happened with that is, as we were trying to help my dad, we kept taking him to traditional medicine. His liver enzymes were off the charts. He got like swelling in the extensor surfaces. His eye had swelled shut. He couldn't even function. And the doctors kept saying, look, he's either has a chronic viral infection or he's got pancreatic cancer, but we don't know what to do. The imaging was negative. The blood tests are horrible. And one of my doctor friends at an event said, hey, your dad has scurvy. Now, scurvy is what happens when you have not enough vitamin C. And so your immune system doesn't work, your connective tissue doesn't work, your eyes, nothing works. And I remember thinking in my head, oh my gosh, Lyme disease was really, really, hey, Jose, it looks like they're telling us we lost it. Oh man, this is really frustrating here. I got to just do a quick tech check. They say that they lost me over here in the comments right over here. So you guys, we're trying to get everything organized and see what's happening with the tech check. I'm really sorry about this. We are going through and troubleshooting right now and looking at it. So we just had a huge drop off on all our viewers up here, and I was right in the zone. And so anyway, I'm going to pretend that we didn't drop off so that we can pick up the replay on this. And it's telling me that we dropped everybody off the West Clinic. Let's see if we can get it back rolling here. Let's try that one right there. Oh, shoot, you guys. Like, we were doing so good with this, and then all of a sudden it stopped. We're going to see if we can pull it up. So, anyway, what's happening, you guys, is they told me my dad had Lyme disease, or excuse me, not Lyme disease, scurvy, and we ended up that we were able to help him with some IV treatments, some IV vitamin C. It took him from death's door to pretty good health. So we went back to school and got a second doctorate. And in that process, one of my teachers was like, hey, there's this horrible condition called, Lyme disease. It's mismanaged, it's misdiagnosed. And so what's happening is I went back to school, got to that doctorate, and learned about Lyme disease. Then I complete that second doctorate. I start doing some vitamin infusions, and one of the patients brought in her deathly sick daughter. And what has happened is we were able to identify that she had Lyme disease, and then we used the vitamin C protocol really to help her. And so that was just a beautiful example of literally the universe saying here. And you can see her testimonial where you literally carried her into the office, not able to function, and then we were able to put her back together. Okay, that being said, let's go through a couple other things that you can do for Lyme disease. So I want to do some nuggets here. Number one is the most important treatment that you can do for Lyme disease is the treatment that you need. Now, how do you know you need something? So let's kind of walk through that a little bit. There are so many things to do to help the body to be healthy. We absolutely need to see how can we put the body back in balance. And so a lot of the Lyme literate treatments are literally saying, hey, let's go give you IV antibiotics or long-term antibiotics. But a lot of times they don't reset the nervous system and they don't get the body to rebuild or repair. And so this is where the testing component comes in. And the testing is looking at different nutrients and things like that. So I'm looking at some of the comments over here. We lost you. I'm really sorry. We're going to pick it up. It says video and sound not working, no volume. Like, we're going to repost this. And Macy and Jose, can you guys be jumping on Facebook West Clinic and be telling people either to get over to the YouTube or tell them where to go? And of course, we're going to repost this. We'll edit out a little bit of that flub and stuff like that we're going through, and then we're just going to keep on rolling. I'm sorry for the technology glitch that we had. It's so frustrating. Okay. All right. So we see a whole bunch of comments. Niall, hey, Niall is saying that, the disease from the Lone Star tick. LJ says it just went off and back. Melanie saying, hi, Melanie. That's saying, I see and hear you. I'm really sorry about that. We're doing our very best to correct the technology glitches. So if you're just joining us, here's what we're going over. We're going over this great imitator called Lyme disease. And what Lyme disease does is it mimics so many different diseases. So if you put 40 people into a room, you're going to see one person that may have stomach problems or joint problems or hormone imbalances or brain fog or fibromyalgia type symptoms or extreme fatigue. Probably the most common symptom that I see in chronic Lyme disease of 25 years of working with people is that Lyme disease basically turns you into a vampire. Now, I'm kind of joking and kind of serious. I feel that there's a lot of Lyme disease. It disrupts hormones, particularly your pineal gland. And so what happens is people are exhausted during the day. They can't really function. And then what happens, it's almost like their body wakes up. They can't sleep at night. It's this vicious cycle where you're exhausted, but you can't rest, you can't heal, you can't sleep. And so that's probably the most universal symptom. But so many other things, heart problems, skin problems. I've seen a lot of eye conditions with Lyme disease, basically floaters. And I see a neuropathy, just a lot of stomach problems, probably just as much sleeping problems as stomach problems. And so let me give you guys some ideas to help that. So we talked about the thymus gland, the spleen, the lymph nodes. That was our first nugget. Then we kind of talked about a little bit of how I got into Lyme disease. And then we really had some disruption on the tech sector. I told you about my dad being really ill, and high dose vitamin C took him from 1 foot in the grave to pretty good health. And that's why I got into the IV vitamin C world. And then in that second doctoral training, what happened is we literally were introduced to Lyme disease. And in 8 years of school, this is what I found out in Lyme disease. This is the traditional education about this perplexing disease is it's this. It's a vector-borne illness, comes from a tick, and only a tick, which I disagree with, but tick. It causes a bullseye rash, 2 weeks of doxycycline or Rocephin, and everybody is better. Now, that is so not what happens, but that's what I was taught. So imagine me sitting in the classroom in my second doctoral program, and a doctor stands up and he's like, this is a horribly it's the fastest growing infectious disease. And this is what he said at the time, and it's mismanaged, misdiagnosed, and misunderstood. And he said, if people come in with symptoms that you're not aware of, what happens is you need to like rule this in or rule this out. And so now let's talk a little bit about the testing phases. So I believe that the traditional treatments or the traditional testing for Lyme disease, which would be, ELISA or PCR or Western blot, probably the Western blot is the most common, is notoriously inaccurate. It only, in my opinion, only works about 20% of the time. And the reason why I say that is there's 5 life cycles of Lyme disease. There's the spirochete phase, the intracellular phase, the spore phase, the budding phase, and the biofilm phase. And the traditional testing, it only is looking for the spirochete phase or the antibodies to the spirochete. So I think it misses a lot of it. And my favorite way to be looking for Lyme disease, you guys, is literally this testing. So this is a medical research process that we do inside of the office. And I'm showing a patient right here that what it looks like to have normal blood, and then his blood is basically on the right. He gave me permission to show this evaluation or this test. And what happens with this is it's just a really neat way to help people understand, hey, look, it can be a different phase. And with that different phase, this is, in my opinion, the best way to evaluate the 5 phases of Lyme disease, which, by the way, it doesn't necessarily mean it's worse if you have the 5 phases. I've had people with all 5. I've had people with 4 and 3 and 2. I've had people come in with positive, 1 band, 2 bands, 3 bands. The criteria from a Western blot is they really want you to have 5 positive bands. And so when we do our workup and we look at people, what we want to evaluate is, the patient history, the exposure to the, to the vector, to the tick. We also want to look at, any Western blot or PCR or ELISA testing that they've done, or I do really like the IGeneX test, and I love a test from Vibrant Labs called, the tick panel and so this is one of the things that we can help people to do, whether you're across the street or across the country. One of the things that we offer is the testing. And this is so important. And it's not just testing for Lyme disease. Yes, that's part of it. We also want to look at the traditional labs of a complete blood cell count and a complete metabolic panel, and then looking at molds. We want to look at heavy metals. We want to look at your environment. You guys, environmental things are so important to see what is the barrier to healing. Could it be microplastics? Could it be heavy metals? Could it be mold? Could it be chemicals? I find so many times where people are just blocked from healing. They're doing so many things right. They are, and I'm going to walk you through some success stories in just a minute. They do so many things right. They eat right. They put their body on a schedule. They avoid sugar. They have a stress outlet. They do their best to have healthy relationships, and they put parameters around other relationships. And if you're doing that, I just want to give you a little bit of hope on here, vitamin H, and that is there's something blocking your healing. Now, it could be a chronic tooth infection, like a cavitation. It could be a chronic viral infection that's going on the same time as Lyme disease. So we're thinking about Epstein-Barr and herpes simplex 1, the canker sore virus. Or is it another type of co-infection like Babesia or Bartonella or Ehrlichia or Mycoplasma pneumoniae or Chlamydia pneumoniae? There's we got to look at that too. So you got to treat the body for the bacterial infection, but maybe we also need to treat for a viral infection. And so this is a really nice way, like the testing is key. Because if we take our foot off the gas and we get rid of that block under the tire, or we get rid of that, proverbial dam where the water's coming in, we block the water flow. That's it. So let me share with you some things that are really important to me. I want to share you like just a quick overview of Jenny's story. So meet Jenny. Jenny's comes from a galaxy far, far away with Lyme disease, been sick for ages. And we were able to literally identify what was wrong, put together a program, just a beautiful human being that just would refuse to give up. And we were able to help her to recover from that. Sally is one of the best. So by the way, you guys can see all of these on our Facebook and our patient success stories at Dr. Jason West on YouTube. A lot of you guys are tuning into this. If you type in Lyme on our channel, you'll see like so many success stories. And Sally had it for 15, 16 years, and we were able to put her back together. Same thing for Sophia. Sophia came all the way from Hawaii, and this was multiple years ago. Now she's in a relationship. She has a beautiful baby, and that phone was really fun to take care of. Brandon, again, a warrior of being sick literally 20 plus years. And we were able to help take the building blocks, the blocks that were blocking healing, and to get him better. And so you're not alone. Now, I do want to give you just a little bit of, again, parameters on things to do. So we talked about getting your drainage pathways working, helping the lymph nodes and the liver and the kidneys and stuff. Here's the other thing. Like if there's probably one thing that I could give people, I guess it would be at least two things. Like my favorite way to help people with Lyme is to help to get your energy back. So what happens with a chronic infection is it just steals your energy. And then what happens is when you don't have enough energy, you go over to these little castles in the body that we call, endocrine glands. So the thyroid and the adrenal gland, or your ovaries, or your testes, and your hypothalamus and your pituitary. And we go to those organs and we work them really hard to get energy. And then over time, what happens is they kind of run out of juice too. And then what happens is we literally are just surviving. Where we used to be up here, and then what happens is people are like, man, I can't function. And so many people with Lyme, I've met so many people that have Lyme that are absolute warriors. Like my hat's off to them, like Brandon and Tana and Greg, some of the success stories I'm going to show you in a little bit, because they don't have a turnoff. They live on willpower. And so outwardly they're like, hammering away, existing. And yet if you had an authentic conversation with them, they're like, man, I force myself to do things and I just don't feel good. Like I would just really like to kind of curl up in the fetal position and suck my thumb, but I can't because I'm a mom or I'm running a business or I just, there's no other options. And so I see these amazing lives of literally willpower and desperation. And I know that there's people, I can see it over here in the comment section, that there's people all over the country that are feeling the same way. And my hat's off to you just being tough, like so tough to do this. So here's the next thing that I would say on that. If there's one thing that I would advise, besides not giving up and being your own advocate and researching and learning, and is literally trying to get energy back into the body. And here's what we do with that. The first thing is we want to take this amazing vitamin and get it to give electrons or energy to the body. This is one of my favorite ways to help people. Now, of course, you can do it outside the office. It's a little bit slower, but I also want to help you, in the office. We can do some advanced treatments where we just want to give vitamin C. Now, people say, wait a minute, that's too simple. So I love Dr. Levy's book that talks about vitamin C as an electron donor. It helps your immune system, your connective tissue. It helps with the joints, the cartilage. It helps with hormones. It helps with your immune system. It helps with your brain. Like, it would be easier to write a book about what vitamin C doesn't do. But here's what happens is people aren't taking enough. So if you're in Timbuktu or you're in the other side of the universe and you're what we can do, like I see a question over here from Linda saying, oh my gosh, like I've had this forever. Where do I start? So Linda, where I would start is I would be like literally going through the testing. I would be going through like, how can we find out the barrier to healing? And that's something that we offer inside of our program. And so to get started, like a free resource, go to lymefighter.com. You can scan it right here. And we have a resource guide there, which can help you to get started. It'll also put you inside of the system where my team can reach out to you and give you the option of like, hey, would you like a across the country program, or can we want to do something inside of the office? There's no obligation to do that. It's just something that like my mission is this, is I want people to beat their disease. I have so much fulfillment in helping people that we're living here to live up here. And so we're busy in the office, there's no question, but we're also on a mission. Like, I want to give people at least some hope. And the hope is, okay, let's figure out what the barrier is. But for people out there like Linda, they're saying, where do I start? Well, we want to start knowing what's the problem, but just to get going a little bit, let's clean out the lymph nodes and just give you lots of vitamin C. Vitamin C donates electrons to the body. Now, one of the things that we get asked all the time, and I want to reserve some questions for question answer period and stuff like that. I see the questions piling up. Again, we've got people gardening. Okay, we have a couple tech things. Now it says here, what about emotional treatments? What kind of testing do you do? Is it possible to recover from? Okay, so we got a lot of questions that we're going to hit. Okay, here's what we want to talk about is so many people are saying, look, I'm so confused because I get on the internet or I talk to my doctor and he says, have you had a tick exposure? And they're like, no. And they're like, well, then you can't have Lyme disease. So I want to talk about that just for a minute. And I also want to talk about the most common question that I get asked, which is this. And that is, can it be sexually transmitted, or can it be transmitted, to my kids? And if I have it, so let's just knock that out right now. And here's what I mean by that. The research is showing that about 60, maybe 70% of people that have Lyme disease don't remember a tick exposure. And by the way, it doesn't necessarily mean that it happened recently. Like one of the patients that it was a hard case, but we were able to really, really help. He was bit by a tick in the early 90s. He had a bullseye rash, jumped on, some natural things for immune system. I think he did a short course of doxycycline. He was back east, and they were found a Lyme letter doctor. They hammered it with, and no symptoms for over a decade. Felt totally fine. Then he had one of his children was killed in an unfortunate accident, and extreme stress. And what happens is all of a sudden, full-on Lyme disease. So one of the things I have to tell people is, like, it doesn't mean you have Lyme disease because you were bit by a tick 2 weeks ago or 6 months or a year ago. Like, I believe that Lyme can lay dormant in your body and then decide to come out and really bother you. And it could be stress, it could be hormones. There's so many things that could trigger that. But I also want to review a couple things with Lyme disease, and especially sexual transmission, because the official guidelines are tick, bullseye rash, Lyme disease. Like, that's how it goes. But that's not always the case. And remember, Lyme disease is a spirochete. And a spirochete, one of the cousins of Lyme disease, is something called syphilis, which is a sexually transmitted spirochete. And so if you can transmit syphilis sexually, it just kind of makes sense to me. And this is not the accepted medical thing. This is just my opinion. I think that you can transmit it sexually. And can you transmit it in vitro? Can a mom transfer it to the baby? And I do believe that that's possible. And I believe that that's happened. That's just my opinion. That's certainly not the stance of the CDC or the traditional allopathic medical community, that's just me saying, oh, syphilis is a spirochete, Lyme is a spirochete. Like, I really think that you can do that. Now, I also recognize, because I do a lot of work with couples, and so if you are suffering, one of the things that I would tell you is you got to make sure that your husband or your wife or your partner, your girlfriend, your boyfriend, that one of the ways that we really help the patient is we want to make sure that the partner is healthy too. So let me kind of walk you through that. Some people in the world, they're just made out of super glue. They get great genes from their mom and great genes from their dad, and they literally go through life and like nothing seems to bother them. They don't get sick. They can tolerate, abuse that they put on themselves, which is, working too much or not. Like I have a guy in my ecosystem right now, and he just amazes me. Runs a business, works like literally 20 hours a day, sleeps like 3-4 hours. Blood looks great. Medical microscopy looks great. And I'm just like, you won the genetic lottery. Then I have people that literally are doing just about everything that you can think of. They're eating right, and they're always struggling and fighting with it. And welcome to the world of genetics. The person that's struggling but just didn't get the tough genes that really their partner does, and opposites attract. And so I see this all the time. Now, one of the things that I would love to give you in a hope sense is it's not just me saying, hey, I can help Lyme disease. So we have a podcast that we've developed called Healing Beyond Your Diagnosis. It's on Spotify and iTunes. And let me show you one of our success stories here. So this is Greg. He came to the office in 2008, literally out of intensive care against medical advice, making the pilgrimage from Washington to the office. And you can see his story of literally going from can't move his joints, eyes not working, can't function, rashes, his stomach's a mess, was able to beat it. And then Tana's story of being in Milwaukee. And I'm not divulging any HIPAA problems. What I'm saying is this is where it happened. She fortunately found a Lyme literate person to help her. And then she ended up in our ecosystem. And here's one of the beautiful things about this story. So here's another nugget. If you have a chronic disease, if you have Lyme disease, you have Epstein-Barr, you have chronic infections, perhaps you have, cancer or something, I want to help you. This is one of the best things that I found, mental and emotional. So you have your physical side over here, and you have your emotional side over here, and it comes together, and it's this wonderful, beautiful, complex person that is you. And let me give you the recipe to be really, really unhappy. Now, people say all the time, Dr. West, why would you tell me that? Of course I don't want to be unhappy. And my response is, well, if you know how to be unhappy, if we reverse engineer it and you do the opposite, like there's the recipe for happiness. And so one of the things that sometimes people have, and I'm going to say more than 50%, not everyone, is we fall into the category of being unhappy. And that is by doing something called comparison syndrome. And comparison syndrome is we have a tendency to take our pathway that we're going through, our journey, and no one knows that journey as well as we do. And then we compare it to someone else's journey that we kind of don't even know. Maybe it's a friend, maybe it's a partner or a cousin or someone that we see on social media, and we compare our lowest to their highest. And that's the thief of joy, and it's the thief of health. And so one of the things I would tell people is, and this is really hard, but I want you to stay out of that ditch, and I want to stay out of that, literally that pothole, because your journey is your journey. And so many times I just tell people, look, and one of the beautiful lessons that I had a patient teach me is this. If you can stand in front of the mirror and literally tell yourself, look, I'm a warrior, I'm still here. Like you'll see this in Tana's story. This is one of my favorite stories, is here she's battling this problem and this condition, and she's driving down the road in Milwaukee, and she's like, my husband doesn't believe me, my family doesn't believe me, but I know I don't feel very good. And she said, literally, someone flipped a switch and said, Tana, you're awesome. for just being here and showing up and fighting. Like, this is one of my favorite stories of someone that beat Lyme disease, because she's just tough. Like, she's as tough as tough as tough. And so whenever possible, I tell people, look, try not to get in the rut or the problem of comparison syndrome. Okay, we are, I'm wanting to get over to some questions and remind people, like, look, there's a guide and resources and other things that's available. And let me kind of give you some rules of health, another nugget here. I want to make sure we get value from our life. Like, one of the best things that we can do, which is really, it's hard, but one of the best things I can do is I can tell people, look, you got to follow 5 rules of health. This is for any condition, but particularly Lyme disease. And those rules of health are this. Like, sleep is underrated. If you can't sleep, you can't heal. So we want to get a sleeping sanctuary. In my book right here, Hidden Secrets to Curing Your Chronic Disease, I have a whole chapter about literally your sleeping sanctuary. So chapter 22, a lot of times people are doing this, but I love just reminding people, look, your sleeping sanctuary is where you go to heal. Then we don't want electronics in there. We don't want a TV. We don't want iPads. We don't want a phone or anything like that. We want to put our body on a schedule, getting enough liquid and water. Then we want to eat as healthy as possible on a schedule. We want to have some type of stress channeling, which would be one of these things, not all of them. But it is going for a walk, or it's talking to yourself, which is probably my personal favorite. Or it could be journaling, or it could be going on a drive, or listening to music, or playing a musical instrument, or having a conversation with someone that you deeply love and is not judgmental. And these people are hard to find in your circle, but I know that there are people out there that, like, I mean, being a father, like, I love my boys, and there are no parameters around that. And I hope they have someone like that in your life, that you can offload some things, that's just going to listen and be there for you. So those are the rules of health. Now, if we start following this, so number 1, we need to figure out which phase of Lyme that you're in. That's the medical microscopy. That's our research. There's so much testing that we can do for you across the street or across the country. We want to start with baseline labs, looking at a complete blood cell count and a metabolic panel. We want to look at your iron levels, and all of those are standard routine labs. I think food sensitivity is a great place to figure out what inflammatory foods are problematic. Looking at a food nutrition deficiency, what I call a whole foods test, where we literally can open up the cells and we can test for 100 plus different vitamins, minerals, essential fatty acids, and find out what your deficient is. And that was Sally's story. Like, when we figured this out, you guys, like, right here, this is when we're like, turned this around, like decades of Lyme disease. And we've done it for everybody that's on here, is these beautiful success stories. And by the way, you guys, if we can help them, like, I just really think we can help you. Like, the sickest of the sickest, I see so many people that have been, I mean, Zach's story, what we talked about earlier this month, he'd been sick his whole life and be able to get his back, and Sally's story, and Amanda's story. Anyway, okay, so do the testing. Let's get energy into your body. Like, just vitamin C is such a wonderful place to start. Like, I can't give medical advice without having a patient-doctor relationship. But for me, like, I'm just like, okay, I'm just going to be around 2,000 milligrams every day, just a preventative medicine. I like the liquid, or what they call the liposomal vitamin C, working on your lymph nodes, and then having that stress outlet. And you guys, this is probably the hardest thing that I get to tell people. And when I say get to, like, I don't like to tell them this, but sometimes the barrier to healing is your inner circle. Now, it's not, I don't think it's intentional, but sometimes your inner circle, like, questions what you're doing, or doesn't believe you, or said, hey, just buck up and just be tougher. Or, why are you have melancholy today? Or, why do you have anxiety? How come you couldn't sleep? Like, why can't you just be like me? And you guys, I hope that you'll give that person in your inner circle a little bit of grace, that they're just telling you something from a viewpoint. And remember, maybe they won the genetic lottery, and the genetic lottery is like, I have people that have been inside my office that are like Marvel superheroes. They don't get sick. They don't get run down. Maybe they are not eating right, and they have their metabolism looks great. Their physique looks really good, and they can walk into a sewer or a sick ward or whatever else, and they're not going to get sick. And so I just want to give people grace. They're not on your pathway. And so maybe it's not a fight that you have, but you literally have to tell yourself inside, they don't understand their own pathway. Okay, I want to get to some questions here. If at any time you guys want to jump literally to the front of the line, you can just go here to right here to lymefighter.com. We have a great little a free resource there. And if you wanted to do some advanced work with us across the street or across the country, like that's where you get into the system. If not, I want to give you value so that you have a better life just from the life. Okay, so let me start going through some questions. Okay, let's see. Wow, I got a lot here. All right, so we have, again, people from Virginia, California. Okay, so let's just start going this. Eva says, how many co-infections are there? So Eva, what I would say of Lyme disease is there is Lyme disease, and then there's probably just a gazillion co-infections. The main ones are Babesia and Bartonella, Ehrlichia. Those are kind of the standard quote co-infections. I personally feel that almost everybody that we have worked with that has a Lyme diagnosis really struggles with a viral component, and usually it's Epstein-Barr. But I almost always find a viral component with it. And so there's at least 6 co-infections. Okay, Kathy says hi from Colorado, and then I've got in Iowa. Okay, upstate New York. All right, Montana. Okay, here's another question here. Do you always get a rash from a tick bite? This is from, okay, Sandy. It says to me, you always get a rash. And the answer is nope. Nope, you don't always. Now, that's one of the diagnostic criteria that medicine likes to follow, is you have a vector come in and it starts a bullseye rash, and then it, it's one of the confirmatory signs. It's really hard to diagnose off symptoms. And most of the time when I see people, it's a long time since they've had a rash. But Sandy, you don't always get the rash from it. Okay. Linda says, if you've been misdiagnosed for over 20 years, where do you start? So Linda, this is where you start. We want to know what a history. When did you start experiencing symptoms? Is someone diagnosed you with Lyme? How did they diagnose it? Where do you fit into the category and everything like that? And then we can do some confirmatory tests. And then we start. And by the way, I would start with the 5 rules of health. Get your body on a schedule, good food, good water. I would be taking vitamin C. Okay, Katie, one of my peeps for ages. Katie says, you do such great work with people. It makes me so proud of you. Thanks, Katie. You and Arvid, okay, right here. All right, now Diane says we're glitchy. I'm sorry. Eva says the video keeps stopping. We'll get a replay, and we can do some other things. Hopefully people went over to Mamie says, will it be posted later? Yeah, we're getting all these things. Okay. Niall says, is the disease that carry Lone Star ticks carry similar? Well, it's a disease that makes you sick. It's a vector-borne. And Niall, for me, I just start with all of those rules, same thing that you've done before, which is the rules of health. And I would treat Lone Star tick disease and Lyme disease literally the same, which is trying to get the drainage pathways working, giving them the most important vitamin, which is the one that you need, most important minerals. Sometimes it's calcium. Most of the time it's magnesium, but there's other mineral deficiencies that are really important. Selenium is critical. I see a lot of manganese deficiencies, which destabilizes the ligaments, which a little nugget here, this is what happens when the Lyme disease bacteria has an affinity. It needs manganese to function. It's kind of like how people need magnesium or need iron to function. Lyme disease needs manganese. Manganese is in the ligaments. When the Lyme disease gets in, it steals that and it causes joint problems. This is a thing here. Okay. Melanie says, hey, I was watching Meat Eater with Steve before the podcast. He shot something and had ticks all over. Like, okay, Melanie, I had a patient in here today that had harvested a deer, and she said they were hundreds of ticks on it. And when she went to the deer, she was clean, like she had ticks and stuff like all over her. Like I would literally be like, I'm sorry that I harvested something, and I would leave. But anyway, if there was a room with like, a rattlesnake or tarantula and ticks, like I'm picking the other rooms, like it would be really, okay. Mamie saying I found you on YouTube. Okay. Carrie says, hey, canker sores, are they viruses? Yes. Well, I mean, I kind of limp those together. Herpes simplex 1 causes those mouth sores. And again, we just want to make those healthy. It's not related to Lyme, but just kind of an idea, like you're too acidic. That's what causes that virus to come out and cause an infection, and working on helping the body to alkaline and lymph nodes, thymus, spleens. Okay, Eva says, do you accept insurance? And Eva, I wish the system was different. If I was literally a wizard and could fix healthcare, I would absolutely fix that. But traditional insurance does not pay for the advanced cutting edge therapies that we do. Matter of fact, they follow the Medicare guidelines, which is they don't pay for care that cures, prevents, or literally helps a preventative medicine program. Well, everything we're doing is helping people to be healthy. They have a tendency to pay for prescriptions, drugs, surgery, some other things. Linda, I wish it was different. Okay. Dawn says, what about treatments do you do for Babesia and Bartonella? And the answer is like, again, working with the immune system. And here's another nugget, you guys. I tell people all the time, you're not your disease. There's a person in there. I don't want to treat numbers. I don't want to treat patients. I want to treat Dawn and Brittany and Macy and Mamie and Jordan as the person. So we want to look at your life and what you're doing, and we want to fix any of the barriers to healing and the deficiencies. And Don, that's exactly what we do with these co-infections for Babesia and Bartonella. So there isn't a protocol for Babesia. I mean, there's some classic signs on red spots, and we can literally, if you have Lyme disease, there's a likelihood you might have a co-infection. When we balance the body, I see the co-infections go away. Don says, you're coming in August. Yes, Don, welcome. I'm excited to see you guys again. Brittany says, can regular Lyme blood work show whether you have Lyme or not? And the answer is maybe. So many factors with that. So, Brittany, what I would say is for conventional testing, my favorite test to do for Lyme is an IGeneX test. Well, let me back up. My favorite test that we can do is this medical research project right here that sees all 5 phases of Lyme, and that's right here. So this is my favorite way to evaluate the 5 phases of Lyme. Now, obviously, this is only an in-office procedure, and it's not recognized by the CDC. I think there's a political reason and stuff for it, but this is my favorite way to evaluate. Traditional testing, I would be running a complete blood cell count. I'm looking at your white blood cell count. I'm looking at your neutrophils, which fight bacteria, or lymphocytes that fight viruses. Now, that doesn't tell me that you have Lyme. It just tells me, is your immune system working? Is it the normal levels? Is the neutrophil count where it's supposed to be around 60% of your white blood cells, and is lymphocyte count where it's supposed to be? That gives me great information. And then I would be doing some IGeneX testing. I mean, Western blot is something that if we couldn't get anything else that I would probably run. Carrie says, is Epstein-Barr the same as mono? And the answer is Epstein-Barr is the virus that causes the disease called mononucleosis. So, they're like this. One is a condition, one is the viruses. Carolyn says, thank you for the information. Brittany says, I diagnosed with Lyme through a full body cell scan, but when I went to my paper, she did Lyme test blood work and all came back negative, only Epstein-Barr. So look, I need to do a live about the Epstein-Barr and Lyme link, because I think it goes just like this. Brittany, I feel that there's probably some chronic Lyme working in your system. The way that I would try and evaluate that is, again, doing this test right here, where we're looking at, by the way, this is part of our workup. I feel that this is the most important thing that when we start with people, is to go through this. Okay, Don says, do you use glandular shots? And so, Don, what I think you're asking is, maybe it's peptides, maybe it's a glandular therapy. There's a way to re-stimulate or to reboot things using neural therapy. And Tim says, Tim, I saw your text. I apologize. Tim, one of my peeps from the state south of us, says, hey, I found a tick on my son last night. What should we be doing to help? So, Tim, what I would be doing is immediately working on the immune system, which is to give vitamin C. This is where I would start with my son. And what I would do with that, number one, is, and then work on the lymph nodes, so using potassium hydrochloric acid, some type of immune system stimulation. I really like some different products. Immune Power is one that we use through the office. I think really helps to get things started. There's a couple Native American herbs. And so, Tim, I'm going to post a response to that, not specifically for you. I mean, it's going to be your question, but that's what I do if it was my son. Okay, Linda says, why does insurance cover Lyme disease? Well, this is another podcast that we could do, but I feel that the reason why, this is my opinion, is because it was a medical warfare disease that got out of control. And there's this whole reason, they don't recognize it. And some other, I just think there's a whole reason in a nefarious reason of why it's not covered by insurance. And then Brittany says, where are you located? I'm in Texas. Well, what I'd say to that, Brittany, is you can come to the center of the universe. I'm in this beautiful little town in Idaho, this beautiful railroad town. My great-grandfather started our office 109 years ago. And so much of what we're doing to help people with chronic disease is the lessons that he learned, that taught to my grandfather, that taught to my dad, and then I'm tried to take it to another level as well. You guys, we have had a wonderful night together. I wanted to give you some nuggets. So here's the nuggets. Drain the lymph nodes, get your body on a schedule, follow the rules of health, try to get energy back into the body. Don't compare yourself to other people's journeys. I really want you to put your arms around yourself. Look, you're still here. You're a warrior. And I'd love for you to get in front of the mirror and give yourself a high five. Then we talked about ways of transmission. In my opinion, it's not just the tick bite. I do believe that there can be a sexual transmission, and I do believe there can be in vitro transmission. That's my opinion, and that's not the accepted norm. That's just what I think. I also believe that you never completely get rid of Lyme disease, but I do believe that you can be normal or asymptomatic. And then the most important treatment is to get the immune system working right. So there's IV vitamin C, there's oxidative medicine, there's neural therapy. I think that NAD therapy has a great place in this process of rebooting your nervous system. I believe that there's so many herbal therapies. Lomatium is really good. I think that Sambuca is really good. I think that dandelion root has a place. There's wonderful herbal pathways. And at the end of the day, I want you to not give up. So if this has been beneficial for me, I'd love for you to join me on a mission. Make a comment, share this with someone. I just want people to know options. My dad, who was a wonderful doctor that taught me so many lessons, said this: people that have all the information in front of them, pick the right treatment for them. And so I just want people to be aware there's more to treating Lyme disease than anti-life therapy, which is an antibiotic approach. So antibiotic approach, I think, is really good for acute. I think it's really hard on you long term. I have so many people that come into the office that said, I tried this for years and it didn't work, or it gave me other symptoms, or now I have, a chronic, yeast or fungal problem, or I have other, unintentional side effects. No one wants side effects from antibiotic therapy, but you can have some severe side effects from that. I really want the holistic approach of building you up, building you up, building you up. All right, you guys, here is an offer for you that I want to help you. By the way, the mission is that no more sick people, especially with Lyme disease. love for you to make a comment or share it or tell someone else about it. By the way, here's what I would love to tell you guys about. You can go right here and learn more. There's a ebook that we put together that I've worked really, really hard on. It's literally 25 years of being inside of the trenches. And the inside of the trenches means treating people that were out of hope and out of time and out of options. And I have so many success stories on our YouTube channel of people that have turned things around. And I want you to be aware that if you've tried everything and aren't getting better, guess what? There is a pathway that we can help you. Like unless you've tried, the neural therapy and the ultraviolet blood irradiation therapy and ALA therapy and AD therapy and hydrochloric acid and dilute hydrogen peroxide and high doses of vitamin C and protomorphogen therapy and peptide therapy, like you haven't exhausted everything. So that is our story, you guys. And literally, here's what I want to just end with is if this resonates with you, go to the website. It's right here. And get your guide. You can scan this. And if you put your information in, my team will reach out to you. And there's let's get you some options. We have programs across the street or across the country. And that's our program for tonight. I'm Dr. Jason West, the Lyme Fighter. And you're going to see us around posting success stories and posting ways to help people. You guys will see on the next video, next Lyme, or we'll see you virtually or online. We'll see you later.